We've seen from our market data that the penetration of presbyopia-correcting IOLs is increasing. And we also know the importance of the workup in these patients because their expectations are going to be higher. And we certainly can't overlook the importance of the ocular surface. We now know, especially from peer-reviewed studies like the ASCRS Corneal Clinical Committee's publication on the utility and the importance of using various testings in the pre-op assessment of the patient, which was provided by the algorithm, that this is something that you can easily implement into your practice. So in addition to the slit-lamp findings of either staining or tear breakup time, we recommend employing a questionnaire that's easily done in your office, and also, if you have access to it, using osmolarity and or MMP9 to assess the asymptomatic patient, because many of these patients don't have symptoms of dry eye, but we know from our publication that 70 to 80% of these patients do have dry eye. This is especially important because we know an abnormal ocular surface confoundedly affects the vision of a patient who has a diffractive presbyopia-correcting IOL. That's how these IOLs work. So the ocular surface problems are exacerbated in these patients. So the last thing you want to do is miss this diagnosis, and last thing you want to do is not treat this prior to getting the measurements and doing surgery on these patients.